I am a gastroenterologist who basically does fecal transplant like Dr. Tom Barodi. And so, fecal transplant, the process of using stools from a healthy donor to an unhealthy to help with C. diff, opened our eyes to C. diff and how we could treat C. diff, not by killing it with microbes, but basically by adding microbes and therefore suppressing it. So, with the same context and understanding C. diff, which is basically started because of a gut dysbiosis. I felt that probably COVID, because it attacked, and that's, me and Dr. Barodi at the beginning, we started on this in January 2020 when we started watching the virus mutate from one area, from China to Italy and then France. And then we started reading all the data from what was going on in France and calling our colleagues in Italy and China, basically trying to figure out a protocol that could help with this problem, because Dr. Barodi had a lot of patents, developed a lot of patents. He was behind the triple therapy for H. pylori. And I've been running clinical trials for pharmaceutical companies for, over 3 decades, well, almost 3 decades, I should say. So I had a portal with the FDA that I could submit protocols. We started looking at what is the best protocol. So we basically started with hydroxychloroquine, Z-Pak, vitamin C, D, and zinc. We posted it. It got approved within 24 hours by the FDA. In fact, I got a phone call at 3 o'clock in the morning saying you're ready to run this protocol. So that was on April 3rd or 4th. We posted it on clinicaltrials.gov. From there, I think, our goal was to keep it in full transparency so everybody could see what we were thinking as physicians and to kind of alert other physicians and save as many lives as possible. Um, of course, at the same time, in March of 2020, our lab, which is a genetic sequencing lab that is spearheading the microbiome research, is the lab that essentially found COVID in the stools in March of 2020. Actually, we already were ahead of the game looking at stools of patients with COVID and identifying that there were different strains to this virus. And basically from that, my biggest question was, well, how can you vaccinate someone with a virus that's mutating, even if you just go to the spike protein? And at that point, I didn't really think the spike protein was the best decision to go to attack this as a vaccine personally, especially because I had done clinical trials for vaccines previously with pharmaceutical companies. So I didn't feel that this was the best approach. I felt that early treatment was the best, in that you treat the family and then you essentially the people that are healthy, you leave them healthy and tell them to take vitamins, and then the people that are basically having COVID, you treat with therapy. From there, it took us a month to get the protocol approved by the regulatory board. Come to find out that the regulatory board was switched off to started doing the clinical trials on Moderna and Pfizer. So therefore, they were not interested in our protocol. So we had to find another protocol. That was in the midst of being, I don't want to say blacklisted, but kind of bullied on Twitter. Tweet on April 20th, just as the protocol was approved by the IRB, because we were trying to recruit patients for these protocols, right, that we wrote and the FDA had approved for us to run. At the time, it was a one-arm protocol because we felt we're in the middle of a pandemic. We should not have to give placebo. We should try to save as many lives as possible. And first of all, it was going to be super difficult to enroll patients in a clinical trial using a placebo, and telling patients, look, you could die. Can you take a sugar pill, right? So when that tweet went off and a lot of people started attacking my company, attacking me, we basically were put on standstill with the IRB, with the FDA. We had to rewrite the protocol, go into a placebo-controlled trial where the placebo was vitamins. So we were comparing vitamins to hydroxychloroquine and Z-Pak. From there, it became political. We got another IRB to approve us. We were finally ready to run the protocol in May. We had a lot of difficulty enrolling patients. So, in my opinion, interference with research was done at the highest level with these clinical trials. It was a shame. And so we put our hats together, Dr. Barodi and I, and hopefully he's on the call, to basically switch to ivermectin, doxycycline, zinc, vitamin C, D, and zinc. And when that happened, of course, we then saw the media started making fun of it, but that made it difficult also to recruit. So I decided to put my hat of a physician, of a scientist with a genetic sequencing lab, and saying, you know what, the microbiome is going to tell the story, because I'm doing 50. So prior to COVID, I was doing 57 clinical trials on the microbiome and disease, mainly because we had achieved improvement with certain patients with fecal transplant. So we had an idea, Dr. Barodi and I, what a good microbiome looks like, something that nobody has yet. So essentially, that's where I come in. I'm on the front line of research, clinical trials. I've done 300 plus clinical trials. My family has done probably over 1,000. My two sisters are in the clinical trial business. My husband's in the clinical trial business. So we've worked with pharmaceutical companies. So to me, to see what has happened and what is happening, and what happened with this pandemic was just, in my opinion, criminal. And it's beyond medicine. It's above. And so that's why I became
Sabine?
speaking. That's it.
Yes. Sabine, can you hear me? Nick Hudson
Yes,
speaking.
yes.
Yeah, it's interesting to hear you say that, because Neil and I were chatting the other day and saying, well, the presence of all of this censorship and propaganda would suggest that COVID is not really in the first place a medical or clinical problem, that it is in the first place a political problem. Have we been speaking to too many doctors and to not enough experts in political science and propaganda?
Well, I think, yeah, I mean, it's definitely, it is political. I mean, there's definitely a component of political there, because, or business. Maybe this is a business, businessman trying to control healthcare, right? That's something else that we've not looked at, right? Because definitely taking over, the media aspect and controlling the media. Look, I've been doing clinical trials for so many years. Recruitment is what we know how to do, right? We use social media outlets. We use, PR. We use physicians referring patients, right? The fact that I could enroll tomorrow for a study with psoriasis, I could enroll 100 patients in a month. The fact that I could not enroll at the height of a pandemic, with a lot of people dying, and every time I would post something on Facebook, I would get like nasty trolls. I mean, like, and I've had to develop a tough skin for all this, because the accusations, the the reputation slander, my name, my race, my, who I am as a, my gender, everything got attacked on every level. So, and the it doesn't stop. It's not stopping. Even though I published my papers, this movement that is attacking the data, that is trying to stop the data from being out there. I have two papers on ivermectin. Both of them are being um, criticized right now, or not criticized, but there's a website called PubPeer, which is basically having people come in and they criticize the peer review. Well, that's fine. You can criticize, but then don't retract, right? Every research needs to be out there. And you can criticize the person and say this person has a conflict of interest and whatever, but it doesn't matter. It doesn't stop the fact that the research was done, the research was written, and the research needs to stay. You want to contradict it? Then do your own research, contradict it, show me that I'm wrong, right? But until then, don't remove a hypothesis from a journal because it interferes with your idea of ivermectin, right? I wrote a hypothesis that said perhaps ivermectin increases the oxygen saturation during COVID, because of the fact that it probably increases bifidobacteria, because it's a similar, the fermentation. What ivermectin is a fermented product of a bacteria called streptomyces, which comes from the same family as bifidobacteria. So it was serendipitous when we discovered that we said, you know what, maybe that's why it works, right? Because we discovered that while people had severe COVID in their stools, the one thing that they had in common was the fact that they were lacking bifidobacteria. So that was published in a paper prior to that said the lost microbes of COVID-19. So if you lose the bifidobacteria in your gut, it would make sense that if you're giving ivermectin at the time that you're hypoxic, you're basically possibly increasing bifidobacteria to come to the rescue to evacuate the virus, right? Because when it comes to viruses getting killed, you need strong bacteria, right? Viruses are are tiny, and bacteria are 20 times bigger, right? So essentially, to fight a virus, you need strong bacteria. You need a diversity of your gut microbiome, right? So that's how I came on with this. And the fact that there's people trying to remove a hypothesis from the journal is just, who is behind this? I don't even
Sabine,
think it's political. I think it goes beyond politics.
Sabine, Neil Oliver here. Just listening to you there, the great passion with which you speak about the trolling and the impediments that were put in the path of your research and the rest. Now, obviously, we all know about the rollout of the vaccines being predicated upon, and the emergency use authorization being predicated upon the idea that there was no other therapy, but what were you being told, apart from the trolling, within the people who were able to to speak to you from a position of authority? What was the justification for trying to get in the way of anyone and everyone trying to come forward with as many weapons against COVID-19 as possible? What were you being told was the explanation for you being discouraged from doing what you were doing?
I think there's a consensus around, and I know a lot of people in the pharmaceutical industry, and I know a lot of people at the FDA and the NIH and National Institute of Standards. We're all baffled, I have to say. We're all baffled because there is a movement that is beyond the politics. This is the movement of the mainstream media. This is a movement of, hi, we're marketing a product, we're selling a product, okay? And if I have to put my guess on all this and going all the way to the top, I would say it's he who has the most stocks or the most to gain from the sale of a product or the control of that sale of the product. So he who has the most money right now runs research.
Yeah.
That's it. So
Okay.
he who pays for the media, he who pays for the television. This is even beyond Pfizer. This is who's paying Pfizer, who is controlling Pfizer, right? So he who controls Pfizer and Moderna basically is behind shutting down this whole, research and censorship, etc. But the problem is, this is what's going to happen. At some point, those people are going to become patients. And those doctors that are innovating treatment are not going to be there, right? Because at some point, you have to realize that the doctors that have stood up in this pandemic are the innovators, the doctors that are thinking outside the box, the doctors that are creating patents for pharmaceutical companies, right? Now, it's really sad when they all join up together because they're seeing corruption. Who's going to be creating the next patents? The suits, the businessmen? I don't think so.